So watch me bring the fire, set the night light. Shoes on, get up in the morning, cup of milk, let's rock and roll. Kink out, kick the drum, rolling on like a rolling stone. Sing song when I'm walking home, jump up to the top of the brown. Ding dong, call me on my phone, nice tea and I'll get my ping pong. This is getting heavy, can't hear the bass, boom, I'm ready. Life is sweet as honey, yeah, this beat chain like money. This go all alone, I'm into that, I'm good to go, I'm diamond, you know I glow up. Hey, so let's go. 'Cause I'm in the stars tonight, so watch me bring the fire, set the night light. Hey, shining through the city with a little funky soul. So I'ma light it up like dynamite. Whoa, bring a friend, join the crowd, whoever wanna come along. Word up, talk, just move right up the wall. Day or night, sky's the limit, so we dance to the breakdown.
Ladies and gentlemen, I got the medicine, so you should keep your eyes on the ball.
This is getting heavy, can you hear the bass? Boom, I'm ready. Life is sweet as honey, yeah, this beat chain like money. This go overload, I'm into that, I'm good to go, I'm down, you know I glow. And let's go. 'Cause I'm in the stars tonight, so watch me bring the fire, set the night light. Hey, shining through the city with a little funky soul. So I'ma light it up like dynamite. Whoa, na-na-na-na-na-na-na-na-na-na. Life is dynamite. Na-na-na-na-na-na-na-na-na. Life is dynamite. Shining through the city with a little funky soul. So I'ma light it up like dynamite. Whoa, da-na-na-na-na-na-na-na, eh. Da-na-na-na-na-na-na-na, eh. Da-na-na-na-na-na-na, eh. Light it up like dynamite. Da-na-na-na-na-na-na, eh. Da-na-na-na-na-na-na, eh. Da-na-na-na-na-na-na, eh. Light it up like dynamite. 'Cause I'm in stars tonight, so watch me bring the fire, set the night alight. Shining through the city with a little fucking soul. So I'ma light it up like dynamite. This is so watch me bring the fire, set the night alight. Shining through the city with a little fucking soul. So I'ma light it up like dynamite.
Hello, grade 4 pupils. This video lesson will cover the week 14 and 15 of our Mapeh class. So to start our discussion today, kindly get your Mapeh book for your reference. Okay, so for the week 14, we will discuss health. Okay, so open your book on page 381, Unit 3. Substance misuse and abuse. Drugs or medicines are substances created or manufactured primarily to promote health or help address a medical condition. However, the same medicines can be harmful when used in a wrong way or for the wrong reasons. So these practices are what are known as substance misuse and substance abuse. So to understand what these are, you first need to know the different types of medicine and their uses. Okay, so certain types of medicines have to be prescribed by a doctor, while others can be acquired without one. So in this unit, you will find out what these medicine are, why some end up being misused and abused, and the potential dangers associated with medicine misuse and abuse. Okay, so first we will discuss the lesson 8, uses and types of medicine. Okay, so medicines are also called drugs. Okay, so what is a medicine? A medicine, that is a substance that is used to promote health, treat a disease, or relieve pain. Okay, so it is usually in tablet or liquid form. It can change the structure or function of the body or mind. Okay, so medicines are primarily used to make a person healthy, but sometimes they can be harmful when they are not used properly. Okay, so medicines are grouped based on their effect on the body. Okay, so first we have vaccines. Some medicines prevent diseases. So vaccines are used for immunization. They help the body's built-in immune system by making it produce substances that fight disease-causing germs that can cause communicable disease like measles and mumps. Then we have vitamins. Vitamins, okay, so some medicines help promote health by providing important nutrients that a person's diet cannot supply. So these are called vitamins. Okay, then we have antibiotics. Okay, so other medicine fights germs. Antibiotics fight disease-causing germs. They kill harmful bacteria that can make people sick. Then we have the analgesics. Okay, these are medicines that relieve pain. Okay, they are called painkillers or analgesics. Acetaminophen and ibuprofen are two kinds of analgesics that relieve pain and also reduce swelling or inflammation and fever. Okay, so these two are the kinds of analgesic that will relieve the pain. Okay, so there are also medicine that treat other medical condition. Okay, so we have antihistamines. Okay, so antihistamines are given to people with allergies. Okay, so if you have allergies, then the doctor will give you antihistamine. Okay, then we have cold medicine. Okay, so cold medicine treat cough and colds. So other health problems such as diabetes and hypertension have medicine to stabilize sugar levels or blood pressure. Okay, so medicines are also classified as prescription medicines or over-the-counter or OTC medicine. Both types of medicine have side effects, so much care is required when taking them. Okay, so there are certain medicines required a doctor's prescription before they are sold by the drugstore or pharmacy. So, nakabantay mo nga or have you noticed that your guardians or parents will buy medicine in the pharmacy then dili hatagan kung walay prescription sa doctor. Okay, so there are certain medicines man god nga need siya og doctor prescription. Okay, so what are the prescription medicines? So prescription medicines require an order from a licensed doctor with a specific instruction written on a prescription pad. Okay, so for example, nagpa-check up mo because you have a fever. So naa ditoy hatagan mo og prescription pad. Unsay gisuwat dito sa prescription pad? Okay. In it, the doctor puts down the patient's name na dito imong pangan. Okay, the age, the address, and the instruction on how to take the medicine. Okay, so na dito'y kanang naay mo ditong imong name, age, address, o katong instruction unsaon nimo pag-take ang medicine. Like for example, 2 times a day, 3 times a day, or you will take it after meal. Okay, so that is that is a prescription medicine. Okay, so the doctor signs the prescription and provides his license number and contact details. So the doctor orders give a specific instruction as to how much and how often the patient should take the medicine. Only a licensed pharmacist is allowed to fill the prescription. Next, we have the over-the-counter medicines or the OTC. Do not need doctor's prescription. Okay, so kani siya wala ra ni siya nagkinahanglan og resita or doctor's prescription. You can just go to the drugstore and buy this kind of medicine. So they are called over-the-counter medicine. Okay, so they are generally safe when they are used as directed. Okay, choose over-the-counter medicines carefully by reading the label and look for the active ingredient to make sure that you are taking the medicine only for the condition it is meant to treat or address. Okay, so for example, gihilantan mo. So, kaybaw naman mo nga what are the medicine nga intended sa inyong sakit. So, mura na inyong paliton dito sa pharmacy. Dili na mo kuan kanang, for example, gihilantan mo dayon, mupalit mo og kanang medicine nga dili siya maka-cure sa imong hilanat. Okay, so you will ask the pharmacist, okay, kanang pharmacist, the one who is selling in the drugstore, okay, if it is safe to take the medicine together with the other medication that you are taking. Because the pharmacist also, kaibaw sad na sila kung sakto og unsay angay imnon. Okay, so then we will proceed to lesson 9. Okay, page 389, cases of misuse and abuse. Okay, so medicines should only be taken when needed. Okay, so remember that medicines are drugs, and when misused or abused, they can cause serious health problems. So misuse and abuse of medicines or drugs are different terms and refer to the different practices. When you say misuse of medicine, it refers to the improper use of medicine. So some example of misusing medicine include the following: self-medication. Okay, so one of the ways people self-medicate is by using an old prescription for the present ailment, or using another person's prescription for the similar symptoms to save a trip to the doctor. Doing this can result in worsening one's condition instead of making it better. Okay, so this means that, for example, gihilantan ka. So during sa katong gihilantan ka, kanang nagsauna, nagpa-check up ka, din nairesita sa kanang doctor o prescription sa doctor unsa imong i-take nga medicine, then after few months gilantan na sad ka. So wala na ka nagpa-check up, nya imo na lang gigamit ang katong old nimo nga prescription sa doctor sa una katong gipagilantan nimo, din mura sad na imong gipalit sa tindahan. Okay, dili na siya maayo kay wala man ta kahibaw nga kato di ay lahi tong nga hilanat ang imong gi-suffer last month or the previous month sa imong gi-suffer karon. So dili na siya maayo, kailangan magpa-check up ka kay lain-lain man nga klase nga sakit ang ato makuan. Aside from that, kanapon, for example, gasakit imong tiyan. So, you will not go to the doctor na mangutana na lang ka sa imong silingan nga kanang unsay kanang day tambal sa sakit sa tiyan kay nakakuan man ka nga gisakitan og tiyan imong kanang neighbor. So kanang muas na lang ka didto og unsay iyahang gitake sa katong nagsakit iyang tiyan din mo sana imong paliton. Dili gyapon na siya maayo. Why? Because dili man mo same og kanang kuan kanang same basin di ay nga kana siya nga kuan kay allergy ka, so kailangan magpa-check up jud. Then we have the double dosing. Okay, so some people mistakenly think that taking a double dose of medication can make them feel better faster. Okay, so for example, in the prescription pad, you are told by the doctor there to drink 1 tablet after meal. Okay, so kay ganahan man ka maayo, atat man kayo ka nga maayo, so you drink 2 tablets after meal. So that is not good. That is double dosing. So imbes maayo ka, ni worse noon imuhang sakit. Okay, so then we have stopping a medication too soon. Okay, so certain medicine such as antibiotics must be taken in full. Some people stop taking their antibiotics once they start to feel better. It is advisable to finish the prescribed medication to ensure that the medication is fully eliminated. If not, the infection may recur and the bacterium will become more resistant to the antibiotic and harder to treat. Okay, so abi kay naayon nakahapit dili na nimo tiwason og inom ang imong mga tambal, labi na kanang mga antibiotics kanang mga medicine nga mo fights og germs. Okay, so kailangan og unsa gani gi-prescribe sa doctor. For example, you need to finish 10 tablets, 10 capsules of this amoxicillin. So you need to finish bisan pag naayo na ka para matotally ayo na jud. Dili kay kana nakatake na kag 7 tablets din ayo na ka so imo nang stop. Naa may tendency nga mobalik to siya kay imo man gihunungan nga wala pa man nakahuman sa kanang 10 ka kanang tablets. So imo jud na siyang humnon kung unsay gi-prescribe sa doctor. Okay, so next, taking medicines over a prolonged period of time or beyond the period prescribed by the doctor. Okay, so this could lead to health problems later in life, such as kidney failure, liver failure, and deafness. Certain medicines can harm in developing fetus. So, females who are pregnant or who have to become pregnant should always check with a doctor before taking any medication. Okay, so for example, your mother is pregnant or planning to be pregnant, so kailangan na siya nga magpa-check up jud na siya before taking any medicine kay basin makaharm na siya sa baby. Kay there are certain medicines nga dili siya pwede sa mga pregnant women. Okay, so what do you mean by drug abuse? Okay, so drug abuse is the use of a drug for reasons and in a manner other than for what is prescribed. Okay, so people who abuse a drug often do so to experience feelings of euphoria, relaxation, or getting high. Painkillers and cough medicines are among the most abused types of medicine. Okay, so some signs of drug abuse include using a drug to get high or a pressure pill. Okay, using unprescribed medication, taking excessive doses of a drug, then chronic or repeated use of a drug. So, improper use of medication can cause big health problems. An overdose, okay, is when a toxic amount of a drug or medicine is taken. Okay, prescription and Okay, again, prescription and OTC medication, illegal drugs, Alcohol and some herbal remedies can cause serious harm when too much is taken in. Okay, so an overdose is a medical emergency. Okay, so sometimes when medicine is taken for a long period of time, the body gets used to it being there. Okay, so the body then becomes dependent on the medicine to function. So when the medication is taken away, the body goes through withdrawal and begin to exhibit symptoms that can become serious and debilitating. Okay, so for example, a person with asthma might take a certain medicine for a couple of weeks. Okay, so if he stops suddenly, he is likely to suffer from withdrawal symptoms such as fatigue, weakness, body aches, and joint pains. Dependence can lead to addiction at times. So, drug addiction, however, is very different from drug dependence. Okay, so people can develop addiction to prescription medicine, illegal drugs, as well as activities such as gambling and gaming. So, addiction happens as a result of changes in the brain caused by using addictive substances. This is because nearly all addictive drugs either directly or indirectly activate an area of the brain that is normally stimulated by activities that make a person feel good, like eating or spending time with friends. So these drugs have a stronger effect on that part of the brain rather than the normal. Okay, so healthy things that give pleasure. When the drug is used repeatedly, the brain is folded into more drug taking over normal activities. Okay, so this makes it more difficult to stop or limit the use of substance. So this makes it the urge to continue using the drugs is so strong that it becomes hard to stop, even if it starts to cause very serious consequences. So then we will proceed to lesson 10, page 396. The dangers of medicine misuse and abuse. Okay, so when medicines have a purpose. Okay, so when they are used properly, they are good for the body and health, of course. So when improperly used, they can cause great harm. Sometimes the harm is physical. This means that the medicine affects how the body feels and functions. Sometimes the harm is psychological. This means that the brain and thinking are affected. Okay, so how can a person avoid misusing and abusing drugs? Okay, so you always consult a doctor and follow his or her advice and prescription. Okay, so there are also short-term and long-term side effects. Some side effects may be experienced after only one use. Example of these are allergy, loss of appetite, loss of sleep or insomnia, elevated heart rate, change in blood pressure, palpitation, seizures, stomach ache, dizziness, difficulty breathing, heart attack, and death. Okay, so we have also long-term effects can include deafness, heart disease, lung disease, liver and kidney disorders, and respiratory failure. Okay, so these psychological effects are deeper. Addiction can change the personality of an individual. So as a result of addiction, a person can do things he would not normally do because his brain has become affected by the drug. So people who have an addiction to a drug cannot control the urge to look for a drug and take it. Okay, so they cannot stop taking it even if they know that they are terrible things that can happen because of taking it. Okay, so other psychological effects include paranoia. Okay, so what is paranoia? Okay, so paranoia, that is a mental condition in which the person exhibits excessive and irrational suspicions and distrust of other people. Then, we have depression, a serious mental condition characterized by extreme sadness, despair, and misery. Then anxiety, okay, a disorder in which a person feels extreme nervousness, fear, stress, and worrying. Okay, then we have aggressive behavior, characterized by physical and verbal acts intended to cause harm to others. Then we have hallucinations. Hallucinations is an experience in which a person sees, smells, hears, feels, or tastes something that do not exist. Okay, next we have the last one, the psychosis. Okay, psychosis is a serious mental disorder in which the person's thoughts and feelings become so impaired that he or she loses touch with reality. Okay, so then we have the lesson 11. Okay, page 401. Proper use of medicines. Okay, so this is an example of a prescription pad. As I said earlier, okay, you have there the patient's name, okay, the date, the patient's name, the age, the address, and the sex. Okay, if it is female or male. Okay, there we have the instructions of medication. Then here, okay, there is a sign by the licensed doctor. Okay, so you have learned in the previous lessons that medicines have serious side effects that can even cause to death of a person. So that is why it is important to use medicines following the doctor's order or prescription. So it is also important to read labels carefully. Make sure that you understand what the label says. Be aware of the expiration dates. Medicine can become weaker or stronger over time, and there is no way to determine the exact effect of a particular medicine once it expires. Okay, so how can a person be sure that he or she is taking medication properly? Okay, so medicine come with labels that give directions for their proper use and dispensation. So a doctor's prescription provides specific instructions for patient's use. Okay, so when taking a prescription medicine, make sure you follow what the doctor says. Do not take more of any type of medicine than what is ordered by the doctor or what the label says. So if someone takes more than what is prescribed, the person will overdose. So in this case, you will call the doctor immediately. So doctor and pharmacists give detailed instruction to help the use medicines properly. Okay, so follow their instructions to avoid misusing medicines, and also you need to follow these tips. Okay, so take medicines only under adult supervision. Take medicines according to directions. Take the recommended or prescribed dosage. Then, take the medicine for the length of time prescribed by the doctor. Even if you start feeling better halfway through the required medication, do not take an over-the-counter medicine for a time longer than recommended on the label. Do not give your prescription medicine to others. Even if you have the same symptoms, you might have adverse reactions to the medicine. Then do not mix medicines without your doctor's approvals. Inform your doctor if you're taking medication for another condition. Check the expiration date of your medicine. If it is expired, do not take it. Okay, so store the medicines properly. Keep them out of reach of other children and put them in a place where the recommended temperatures. You can purchase prescription medicines from drugstores and pharmacies. Okay, so this is for week 15. Okay, so let's talk about the physical education. Okay, the unit 4, page 311. Physical fitness and alahoy and ba-Ingles folk dance. Okay, so folk dances mirror our country's culture and tradition. It is said to be the oldest form of dance and the earliest form of communication. So let's learn more about folk dances and get physically fit at the same time. Okay, so in this unit, you will be learning the alahoy and ba-Ingles folk dances. Okay, so first we will discuss the Unit 12, page 312, Folk Dance Alahoy. Okay, so alahoy is a Philippine social dance mixer in which changing partners is part of the dance. Okay, so this may be the reason why the dance is called alahoy, which literally means hello. Okay, however, in this case, alahoy may also be used as see you again or goodbye. Okay, so a circle of partners performs the dance. Okay, so here we have steps and styling, the heel and two. Okay, you will point your right heel on the floor and then your two. Then you will move your hands back as you move your heel back. Okay, then you will touch your two toward. Then this can also be done to your left foot. Then shuffle. Step your right foot forward. Put together your right feet by stepping your left foot near your right heel. Step your right foot forward. Shuffle may be done in any direction. You may also start with either foot. Okay, so how can dances be part of the culture? Okay, so dances are usually performed in social gatherings. So dancing can be useful for interaction and making connections. So if the gathering is practiced often and a dance is always performed during the event, the dance will become part of the culture and tradition among those people. Okay, then we have the lesson 13, folk dance, ba-Ingles. Okay, so ba-Ingles means English dance. It is derived from the word baile and baile. Okay, it is derived from the word baile and Ingles. Okay, so this dance was brought to the Philippines by the English traders in the early days. So the dance has the nature and characteristics of English dances. Though in the last figure, some characteristics of Ilocano dance are evident. Costume worn in this dance are any traditional clothes for the Ilocos region. Okay, so we have here steps and styling. Shuffle. Step your right foot forward. Step your left foot near your right heel. Then, step your right foot forward. Then, shuffle may be done in any direction. So, you may also start with either foot. Okay, so hands. Okay, so place your free hand on your wrist with your palm facing outward. Okay, kumintang, raise your right hand at the side to your head held level. Move your hand gracefully by making a clockwise movement. Okay, so how can dancing develop your body? So dancing can develop your body and improve your fitness. So dancing is a form of physical activity. If physical activities are done regularly, the fitness levels will improve. Okay, so for more information about the folk dance Alahoy and folk dance Baingles, okay, please watch in the YouTube about this dance. Okay, so that would be all for this week, grade 4 pupils. I hope you have learned something new today. And if you have any questions or clarifications, don't hesitate to message me on my messenger account, or you can raise your clarification during our virtual discussion. Keep safe and God bless everyone!